Antisocial personality disorder, often abbreviated as ASPD, is a complex and often misunderstood mental health condition. Characterized by a pervasive pattern of disregard for the rights of others, individuals with this disorder frequently violate societal norms and laws. The importance of understanding ASPD extends beyond clinical settings, impacting social interactions, legal systems, and broader societal structures. In this video, we aim to shed light on the intricacies of ASPD, delving into its characteristics, causes, and the challenges faced by those affected. The concept of antisocial behavior has been recognized for centuries, but our understanding of ASPD has evolved significantly over time. In the early days, behaviors now attributed to ASPD were often seen through the lens of moral failings or criminal tendencies. It wasn't until the advent of modern psychology and psychiatry that these behaviors began to be understood as manifestations of a deeper, underlying disorder. This shift has allowed for more nuanced perspectives and more effective approaches to treatment and management. Defining antisocial personality disorder. To comprehend the full scope of antisocial personality disorder, it's crucial to understand its diagnostic criteria as outlined in the DSM-5, the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Individuals with ASPD exhibit a pervasive pattern of disregard for and violation of the rights of others, beginning in childhood or early adolescence and continuing into adulthood. Symptoms include deceitfulness, impulsivity, irritability, aggression, consistent irresponsibility, and a lack of remorse for actions that harm others. The prevalence of ASPD in the general population is estimated to be around 1–4%, with higher rates observed in certain populations, such as incarcerated individuals. Studies suggest that ASPD is more commonly diagnosed in men than in women, with onset typically occurring in late childhood or early adolescence. These demographic insights are critical for understanding how ASPD manifests and who it affects most profoundly. Psychopathy versus sociopathy. A common source of confusion in discussions about antisocial personality disorder is the distinction between psychopathy and sociopathy. Both are considered subsets of ASPD, but they have distinct characteristics that set them apart. Psychopathy is often seen as a more severe form of ASPD, marked by a specific set of traits. Psychopaths tend to be charming, manipulative, and extremely calculating. They often lack empathy and remorse to a greater degree than sociopaths, and are skilled at mimicking emotions they do not actually feel. Historical examples of individuals exhibiting psychopathic traits include infamous figures such as Ted Bundy, whose outward charm and intelligence masked his violent tendencies. Sociopathy, on the other hand, is characterized by a higher tendency towards impulsive behaviors and a greater likelihood of forming attachments to specific individuals or groups. Sociopaths may exhibit more erratic behavior and are less able to maintain a facade of normalcy compared to psychopaths. Their actions are often more disorganized and less meticulously planned. Causes and risk factors. Understanding the causes of antisocial personality disorder requires a look at both genetic and environmental factors. Research has shown that genetics play a significant role in the development of ASPD. Studies involving twins and families suggest a heritable component, indicating that individuals with a family history of ASPD are at a higher risk. However, genetics alone do not account for the disorder. Environmental factors also play a critical role. Childhood trauma, abuse, neglect, and exposure to violence can all contribute to the development of ASPD. A dysfunctional family environment characterized by inconsistent discipline and lack of emotional support can exacerbate these tendencies, leading to the full manifestation of the disorder. Impact on individuals and society. The impact of antisocial personality disorder on individuals is profound. People with ASPD often struggle with maintaining relationships, holding steady employment, and staying out of legal trouble. Their disregard for societal norms and the rights of others leads to conflicts and challenges in various aspects of life. The lack of remorse and empathy can make it difficult for them to form genuine connections, leaving them isolated and often involved in criminal activities. On a societal level, ASPD presents significant challenges. Individuals with the disorder are more likely to engage in criminal behavior, contributing to higher crime rates and burdens on the legal system. The costs associated with legal proceedings, incarceration, and rehabilitation are substantial. Moreover, the healthcare system also bears the weight of treating individuals with ASPD, particularly when comorbid conditions such as substance abuse or other mental health disorders are present. Treatment and management. Treating antisocial personality disorder is notoriously challenging. Traditional therapeutic approaches, such as cognitive behavioral therapy, CBT, can be effective in some cases, helping individuals recognize and change their harmful behavior patterns. However, the success of therapy often depends on the individual's willingness to engage and their level of self-awareness, both of which can be limited in those with ASPD. Pharmacological treatments are sometimes used to manage specific symptoms or comorbid conditions. Medications such as mood stabilizers, antidepressants, or antipsychotics may be prescribed to address issues like aggression, depression, or anxiety. However, these medications do not cure ASPD and are often used as part of a broader, multidisciplinary treatment plan. In conclusion, antisocial personality disorder is a multifaceted and deeply impactful mental health condition. By understanding its diagnostic criteria, distinguishing between psychopathy and sociopathy, and recognizing the genetic and environmental factors at play, we can better appreciate the complexities of ASPD. The disorder's profound effects on individuals and society underscore the importance of continued research and empathetic approaches to treatment and management. As we move forward, fostering a greater awareness of ASPD can help reduce stigma, improve interventions, and ultimately support those affected in leading more stable and fulfilling lives.